Dr. Umair Qureshi, correct?
Yes, well
Yeah,
pronounced.
Dr. Umair Qureshi. And Dr. Umair Qureshi is working at the famous Aviv DPWorld Clinic. It's not a hospital, is it? It's a clinic.
It's
Or
a
can
clinic,
you stay overnight here in this?
No,
No.
it is a well.
No, so it's like a daycare clinic, and it is one of the. I'm always looking for the edge of medicine. This is an edgy medicine. It's the top of the top when you go for anti-aging. If you want to have the latest shit in medicine, you need to come here. Yeah. So what is it that you're doing here in this clinic?
In essence, what we're doing is looking at factors that are implicated within the aging process. And what we've noticed is that probably the major rate-limiting factor is oxygenation to the end organ, the end tissue, in particular the brain. Our tagline here is brain performance for life. So ultimately what we're trying to do is assess and then optimize brain performance. And we're doing that with a very specific program, a very unique protocol at which I would say hyperbaric oxygen therapy is the core principle.
Yeah, so brain performance, that's it. So aging, I mean, everybody's talking about aging right now, and aging, when we think of aging, we see our wrinkles, we see that we get more and more pain in the joints, and that we are not so fast running anymore, that we run out of breath, that our blood circulation system doesn't work so well. So many of our body functions are somehow decreasing, and in fact, actually, the aging process starts already at the age of 30. We were talking about this, yeah. And there's not much you can do about this until now. But your concept focuses on the functions of the brain, and to be honest, you don't feel this, that the brain performance gets less and less, and until you really become forgetful, or you think, damn, why I don't understand this, for example, yeah, why is it taking me so long to get the sense behind, for example, a scene in a movie or so, yeah, and those are the brain functions, and you are focusing on the brain functions. Sounds really incredibly interesting.
I mean, it is. I mean, you're clearly struggling a little bit right now there, trying to find the right words.
Yeah.
And again, people have this concept of being old, being to a degree frail, being unable to function at the level that you used to perform earlier. I mean, don't get me wrong, I'm coming up to 40. I'm not the same machine I would say I was when I was 20. And equally, when I'm 60, I'm sure I will look back at 40 and say, I'm not quite there. Now, we are always trying to improve ourselves. We're always also trying to create a pathway that, if we travel down this, will give us the best, ultimately, the conditions in which to function in the future. And I think that's something that we are trying to facilitate. We are trying to create these conditions so that people are aging in a way whereby you're maintaining your function and your performance to the best of its ability.
Yeah, and but if the child is already fallen into the well, if everything has gone downhill already, can you restore or can you recover some things? Can you go back in time? Is it possible to get the old function back?
I mean, I think you can improve your old function, but it depends what we're dealing with. The question when you say the child's fallen down the well, ultimately, how far down are we dealing with? Are we dealing with someone who's right at the bottom and therefore we can't bring them back up, i.e. someone at the end stage of something like an Alzheimer's dementia that's unable to even recognize their own spouse? Or are we talking about people who are taking that a little bit longer, forgetfulness for where I may have placed my keys, struggling with remembrance of names or the speed at which they're trying to gain it? It's not an all or nothing concept, and I think this is quite important. It is a spectrum. It's like going down a ramp rather than falling off the edge of a cliff.
Yes.
Where I'm at, where you're at, it's not so different in that we can measure it as a sudden drop. It's a gradual decline. And where we catch it is definitely quite important, where we can improve it to a specific degree. However, if you're at the end of that spectrum, I think there's ultimately going to be limitations.
Yeah.
Similar to hearing. You catch hearing, if somebody's completely deaf, at the end where they're completely unable to hear anything, you're doing the audiogram and you find they're right at the bottom. Realistically, can you bring them back?
Not really, yeah, but I mean, if they are completely deaf, there is not much you can do, yeah.
And it's the same concept. Complete loss of auditory function, or that organ specifically, you're not going to bring them back. Whereas if they're slight reduction in their hearing, you can facilitate it with whatever it might be, whether it's surgical, whether it's a hearing aid. In the same way in which if you apply that concept to the brain and you're slowing down a function, why can we not improve that and bring it back up a little bit?
Yeah, although I heard that recently there was a publication of some gene therapy for the inner ear, so to restore the hairy cells in the cochlea.
Interesting.
So everything's coming, and if you can just maintain yourself for a little bit longer, you have again more time, for more improvements possibly.
Absolutely, and that concept that you speak for us is something that's core to our ethos. And what I mean by that is, we are living in a world now where people are living longer. We agree.
Yes.
You look back 20, 30, 40 years ago, we're dying younger. So we definitely have improved our lifespan. What we are trying to do is bring your health span in line with your lifespan, i.e. living for longer, but making sure that every day that you are living is at the same quality that you're living at the moment. And for me, that's an important concept, and I'm sure you'll agree.
Yeah, absolutely. And the fact is, actually, there was, for example, hyperbaric oxygen chambers are on the scene or in the medical scene already since ages.
Yeah, absolutely.
30 years, 40 years or so. Yeah, I told you the story about the chamber which was in the hospital where I grew up, where I did my postgraduate training in Bremen in Germany, and then for a long time nobody was talking about them anymore. Yeah, and then I heard about Aviv Clinic only when I got an invitation for the first year anniversary here, and I found the idea very, very, very good, and I read about this concept, which is actually a completely different approach to hyperbaric oxygen. Yeah, the action actually happens when you're not having the hyperbaric oxygen. Correct? What is the idea? There is a breakthrough invention by a very good scientist that is behind this, who actually also co-founded the clinics. Am I right?
Absolutely, yes. So Professor Shai is really the pioneer of what we're doing over here.
Yeah.
And it comes on the back of years of research, in excess of 15 years of research. And initially, I think the initial thought concept was very simple. The question that was asked was, can neurons regenerate? Ultimately, can your brain tissue regenerate itself?
Yeah.
And actually, his theory or hypothesis was, no, they cannot. And what he actually found was inverse to this. And this basically set him along this journey of trying to integrate hyperbaric oxygen therapy with improvements in neuronal function. And that's where it all originated, to bring us to where we are right now. Now, like you mentioned, hyperbaric oxygen therapy actually has been around for almost 100 years. Traditionally was used in diving medicine. My exposure outside, prior to joining Aviv, was ultimately within the emergency department for carbon monoxide poisoning. We typically would use it. And outside of that, in general medicine, exposure to diabetics, diabetic wounds. And if we take the concept of a diabetic wound, it's a wound within an area which ultimately has a compromised blood supply. Now, why is a wound in a leg any different to a wound in the brain? It follows, to a degree, the same physiology. Your lack of oxygen, lack of blood supply, lack of ability to almost gain the food you require to function. Now, if that's happening within, and we can treat it and resolve it within the leg by placing people into a hyperbaric environment. So why can we not improve micro damage to the brain, causing wounds in that same environment? So what we're ultimately doing is placing them within this environment, hyperoxygenating and hyperperfusing the tissue, getting more oxygen to the end organ and improving it, which is, like we said, great while you're in this chamber. How do you maintain that benefit when you're outside of the chamber? And that's where the clever part comes in. So we spoke about...
Let's first explain to our listeners the meaning of hyperbaric oxygen. What is actually happening in the body? What's the meaning of the word hyperbaric oxygen?
Excellent. So if we break it down, hyper by definition means more, excessive, increased amount. Baric or barrier is essentially the Latin for pressure. So more pressure, oxygen therapy. So what we're actually doing is combining the effect of high pressure with a high oxygen environment synergistically to ultimately improve the oxygenation within the human body. And the way in which it works is we use the clever field of physics. Specifically within physics, there's a law, Henry's law, which states when you apply pressure to a gas in the presence of a liquid, it ultimately squeezes those molecules and increases the absorption of the gas within the liquid. Now, if we apply that theory to us as humans within this environment, if we're able to pressurize you in the presence of a high oxygen environment, we're able to absorb or push more oxygen into blood, being the liquid, and therefore we can increase the amount of oxygen that's flowing through your blood. And as you know, blood is a combination of plasma, red blood cells, white blood cells. Normal oxygen flow is dependent on red blood cells.
Well, correct me if I'm wrong, at the normal pressure, the sea level pressure that we have around 21% oxygen in the air. And at that pressure, we will be able to upload our red blood cells to nearly 100%.
Pretty much.
With oxygen. I think it's 97% of it goes into the red blood cells, and 3% will be forced by Henry's law? Into the plasma. So it will be in the plasma. And now what you're doing here is not only you increase the pressure, so that more will go into the plasma, because obviously the red blood cells are already fully loaded. And then you do something else. You also increase the percentage of oxygen.
So just the sheer effect of pressure. So essentially, when we mean we're pressurizing, we can pressurize to different levels. What we're actually doing is doubling the atmospheric pressure. So we're going to 2 ATA, which essentially is the equivalent of diving down 10 meters. And what we do is the deeper you go, the more pressure you apply, the more you squeeze. And basically, you're doubling up the partial pressure of oxygen. So what you're doing is providing double the amount. So even without the oxygen, you're gaining a benefit. Now, if you apply 100% oxygen to this environment, you're then completely saturating all the red blood cells, but you're also flooding the plasma with more oxygen, which means, like you've mentioned, if you were using the analogy of that 3%, what you're actually then doing is applying more and more oxygen to this environment, which means you're able to basically almost flood it or douse it in oxygen, and therefore you are now transporting oxygen independent of red blood cells. And there was actually a famous study where somebody actually carried this theory out on, they used it on a pig model, but ultimately what they did was exsanguinate all the blood, replace it with a plasma equivalent, and place the animal within the hyperbaric environment, and the animal, the pig, was able to survive independent of blood.
Without red blood cells.
Absolutely. And then they basically repeated the process, put it back in, and the pig survived. So what it shows is actually, in the hyperbaric environment, you could actually, in theory, provide enough oxygen to all of your vital organs, independent of having red blood cells.
It's amazing. This is really an amazing experiment.
Absolutely. I think this was done in the 60s.
Very good. But then, so with the help of such a chamber, we can have much more than the 3% in the plasma.
Absolutely.
How high are the oxygen levels then that are measured in the plasma?
Ultimately, we're looking at a 20-fold increase, 20 times increase. More so than what you would be operating at on a normal basis.
So that would be 60%. Or 60. Oh, you don't know. Yeah, it cannot be, because that was 3% of the 100%.
Absolutely.
It doesn't matter much. I'm anyway not so good in maths.
That's the reason we became
yeah, exactly. So, but going back to that, so now we have a high oxygenized plasma or liquid, body liquid. So we have it in the entire body, and it would even work if you take out the of a laboratory animal, you take out the blood, it would still survive by this high oxygenization. And now we have this. Where is the benefit? Where used to be the benefit? And then we come to the next step, what you're doing here. But tell me first the benefit of the patient when he's on high oxygen levels.
So ultimately, while you're in this environment, and we'll go back to the aging process, there's a difference between, you mentioned it earlier, as you get older, cardiac function, pulmonary function, cognitive function, muscular function, it all declines. What's the rate limiting factor? Getting oxygen. Why is that an issue? Because ultimately, as we're aging, the vessels that we utilize to get oxygen or oxygenated blood to the end organ start to narrow. If you look at the elderly population, strokes, heart attacks, they're common, or they're more common because ultimately damage to vessels is compromising blood flow. Now, if you can come up with a way in which you can overcome obstruction, i.e. a unique way to increase the amount of oxygen within every substance of blood, you can in theory overcome narrowing by flooding through a very hyper-concentrated liquid, i.e. hyperoxygenated blood, and that can overcome an obstruction or an obstacle, which means you can have less blood that in theory can go through to provide you with the same amount of oxygen. Because remember, we're dealing with 20-fold concentration increase.
So, for example, if somebody has a diabetic foot or a wound that has a decreased blood circulation, in such case, this treatment in hyperbaric oxygen chamber is very beneficial because we don't need the blood circulation, for the oxygenization.
Absolutely.
Your concept. Because anyway, I mean, normal blood cells, they are anyway fully oxygenated at normal circumstances. But the use of the rest of the body liquid to transport the oxygen to the wound will help for a faster healing. And then obviously, when we have a healing process, we make new vessels, and then blood circulation kicks in. And like this, you can get a better healing, correct?
Absolutely.
So when should you start that? Should you start this treatment before a surgery, for example, or if you're diabetic, can you do it anytime? Is it anytime beneficial?
I mean, ultimately, there's different indications for what you utilize the hyperbaric oxygen therapy for. Now, if I was to break down what we do, the core of what we do is ultimately the healthy aging. It's essentially, I like to call it augmentation of the healthy aging process. Okay. You want to create the best conditions for people to age in essentially as healthy a way as possible.
Yeah.
So typically aging, we said earlier on, starts around the ages of 30.
Yeah.
But realistically, people have enough reserve that they can perform. You probably start to notice the first signs of aging from a cognitive point of view around your late 40s, early 50s. So for the bulk of the population, this is the kind of age that you'd be looking at least assessing where you're at, and then seeing, am I performing where I should be, or is there something that I can do to improve that? But again, this is just one cohort. When you take out people who are performing at a higher level, so athletes we're talking about, these guys can sometimes start at a much earlier age because they're working at a much higher percentage than the general population.
I want you to elaborate about this whole point a little bit more in detail. Let me finish the first part of our conversation with the blood circulation, just to make that clear. So this old concept of hyperbaric oxygen chambers, which has been there for a long time, has been used mainly for this reason, to put more oxygen in the plasma. And that helps for healing and for good healing. It speeds up the healing, and it speeds up also, or it can aid to processes that happened already with a lack of blood circulation. And I'm coming from the field of ear, nose, and throat, and we have to deal a lot with people who have sudden hearing loss, for example, or tinnitus, or some issue with their ears, which is deemed to be due to blood circulation problems. And here the classic hyperbaric oxygen therapy would help. But now there is also this new technique that you are promoting here, which aims much further than only the profane healing or the profane day-to-day problems where people seek a quick fix. You're looking further down the line, and you want the people to stay healthy and stay mentally and physically healthy, and maintain a high quality of life through your therapy, and thus also age with grace, or age, but without getting biologically aged, or with slowing down the biologic aging at the same time.
Yeah, to a degree.
And how do you do this?
So we spoke about putting people in this hyperbaric environment and what the benefits are, which is great while you're in the environment. But ultimately, how are you going to create an infrastructure for a human being in order to create or prevent them from aging and essentially having the negative effects that occur with it? Now, what's unique about what we do is we utilize a very unique protocol, which is based around fluctuation of oxygen. So we've already talked about hyperoxygenating, which is great while you're here, but when you go out into the real world and you go out of this environment, in theory, you'd lose those benefits. However, if we can create a situation where we fluctuate oxygen from a normal level, a normoxia, to an extremely high level, hyperoxia, and we cycle between these two levels, what you've then done is create a delta. You've actually created two different sets of conditions. Now, the body is an amazing thing, I'm sure you'll agree, and it responds to change. What we are doing, essentially, is creating a new norm, which is the hyperoxia, the high level of oxygen, and the normoxia being the threatening environment, akin to a normal oxygen environment, and a hypoxia. When your body is threatened with a low oxygen environment, it creates changes to protect you. Now, if we can create those very changes without causing any harm associated with the low oxygen environment, then we gain all the benefits without any of the harm.
So basically, you trick the body and tell him, now the high oxygen levels, this is actually your life, and then you take it away from the body, and he has to struggle with the normal conditions that he usually used to live in.
Yes. Well, it perceives the normal conditions to a degree as a threat or as a struggle, as you mentioned. Yeah. So what do you do when you see a threat? Yes. What would you normally do? You normally would do something to protect yourself.
Yeah. Yes.
Now, what we're doing to protect ourselves ultimately is activating a cascade of changes. We're putting a little switch on to say, listen, let's get the cavalry out. Let's basically protect ourselves.
Yeah. Do I feel this? Then do I feel bad, or do I feel this? Do I feel this threat?
No, this is the beauty of it all.
Yeah.
Because what you're doing is creating the changes that are going to protect you from the threat without having the threat, because we're not actually putting you in a hypoxic or a low oxygen environment. In a hypoxic environment, you probably would feel those changes. You probably would feel the damage that occurs. Whereas in a normoxic environment, which you're perceiving as the threat, but actually on a biochemical level, it's actually perfectly fine to function at this level. You're used to it.
Yeah.
So you've gained all of the benefit of responding to a threat without any of the damage associated with the threat.
So once I have this, let's say I go to the oxygen chamber, I get some benefits from that as well, the benefits that we initially explained. But I'm actually here to get used to this environment, correct?
Yes, you're like I said, creating the infrastructure to protect you in the long term.
Yeah. And then when I'm out of the oxygen chamber, then my body starts feeling the threat, but I don't feel the threat.
Essentially, yes. So what you've done is you've created the environment, and you're almost fortifying that environment. You're almost creating and consolidating those changes to the point where you've responded to the threat. You've got new vessel formation, angiogenesis. You've got activation of stem cells. You're repairing damage. You've got some neuroplasticity going on. You're reconnecting neurons, or you're either reconnecting neurons or you're consolidating pre-existing neurons, and you're ultimately optimizing the function of your organelles, and in particular your mitochondria, so that you can function in a more efficient manner.
Yeah, so I think it would be probably the same what would happen to you if you decide to move for a month or so into a high mountain area, where you have also less oxygen pressure. Is this correct?
To a degree, yes.
Because you have less pressure, the Henry's law does not pressurize so much oxygen in your body, so it will be harder for you to get the oxygen out of the air.
Yeah, so 2 points on this I would like to make. Number one, when we look through the clinical research about quote-unquote altitude-related training or altitude adjustments, first and foremost, when we look at the evidence from sleeping in a low altitude, training at a high altitude, training at a high altitude, sleeping in a high altitude, we've tried all of the different possibilities. Actually, the research there is relatively weak. There is some argument for some high-level athletes that they will gain the improvements, hence you'll sometimes see marathon runners typically doing this. But generally speaking, the evidence there is not great. The other argument and the other situation is, and I like to use the example of Everest here. When people go to do Everest, you set up space in base camp.
Yeah.
And what you actually end up doing from base camp at a high altitude is you spike yourself slowly and you acclimatize to altitude. Acclimatization to altitude is essentially triggering the changes that we want. However, what you'll also notice is it's coming at a compromise. So yes, you are gaining the benefits of triggering hypoxia, normoxia, but it's also coming at a cost. And you notice people have altitude sickness. People will struggle with the negative effects of hypoxia whilst they're also gaining benefits. What we're trying to do is gain those benefits without causing any of the harm or damage.
Yes, because the normoxia is the low level.
Yes.
Yeah. That's a very smart idea, and I wish it would be my idea.
I wish it would be mine as well.
But so what's happening in the body when we are under this threat? It's on a molecular level.
So ultimately, when your body reacts to any threat, when your body sees a threat, it's ultimately making changes to adjust to it, to adapt to it. I'll give you examples. When you're in the heat situation, we live in Dubai in the summer.
Yeah.
The moment you walk out, what happens? You're drenched in sweat.
Yes.
You turn red. Yeah. Because this is the adaptation that you're making to adjust to that environment. When you're in the cold, the other way, your hair stand out and you start shivering. You're trying to create some thermogenesis. Now, in a hypoxic environment, what you ultimately want to do is try to protect yourself and protect yourself from organ damage. So the repeated hypoxic environment means that you need to figure out a way to get oxygen, to get blood flow to the end organ without causing damage. So what we're doing actually, we're triggering activation of an amazing chemical known as HIF. Hypoxia, low oxygen induced factor. And HIF is like pressing on a switch to create multiple changes so that we can protect the body. Now, I very easily touched on new vessel formation. What HIF does is trigger off vascular endothelial growth factor and creates new vessel formation.
It's already too complicated. just
new vessels.
Put it in simple words. So the effect of that is happening with factors.
Absolutely.
So the body is producing certain factors. Factors are proteins, are little molecules, peptides that has a certain function, give a signal.
Absolutely.
And these factors would not be there if we wouldn't go through this delta, through these changes in the environment. So we are coming into this situation that our body feels threatened, and now he or she is doing some production of peptides or substances.
Yeah.
And they are floating in the cell or outside of the cell in your body and creating various things. For example, new vessels.
Yes.
And what else can they create?
So, stem cells.
Stem cells. New stem cells.
So your endogenous stem cells within your body,
Yeah.
they're a combination of increased production,
Yeah.
proliferation, replication, and then migration, moving to the areas where they're required.
So they activate this.
Yes, ultimately.
Yeah. So stem cells are actually sleeping in the body, waiting
as
for
you know,
a chance to come. Yeah.
Stem cells always wait for a chance to come. You injure yourself, stem cells increase.
Yeah.
You cut yourself, you need 3D print a new skin, and this is all part of that stem cell process.
Yes. And what else?
So ultimately, the next step would be we touched on the brain specifically.
Wanted to hear.
Wait. I had a feeling you were edging me towards that. So ultimately, we're talking about neuroplasticity and neuroregeneration. Going back to what the original thing that we tried to disprove.
Yes.
So ultimately, we're talking about consolidation of your pre-existing connections within the brain, so that information can pass quicker, smoother, more accurately. And then we're talking about the argument for neuroplasticity and neuroregeneration. So reconnection of areas within the brain which may have been compromised or damaged, so that ultimately you can pass information across. And this will play into the fact that we can improve cognition in this way. And what is cognition? It's your memory, it's your attention, it's your information processing speed, and it's your higher level of thinking, the executive function that we rely on.
Yeah, so those are the functions of our body, which you can maintain and improve with this therapy. But there is also another aspect, and that would be the overall survival of cells. Is it correct? That is more inside the cell. There's something else happening, which is also like a miracle, which is also due to this delta, correct?
Absolutely. I mean, when we think about what the ultimate end organ that we're targeting or the end, if we break it down, what is the one organelle, or what is the one part of a human body that you would want to improve, that would ultimately trigger a cascade of events that will ultimately mean that your overall well-being is maintained or improved?
That would be mitochondria.
Absolutely.
Yeah. So
what I did?
Organelles are little organs in the cell, because if you look at it with a microscope, you would probably think that each and every cell of our body is like a complete organism, already ready to go, and individually survive. And the organs of this little cell are obviously not organs, they are organelles, and one of them, or one most important, is the mitochondria. Just keep that word in mind, it's mitochondria. I don't think that we have to go into details what mitochondria do. What are they doing?
I'm not going to go into too much detail, but I'm going to keep it very simple. Your mitochondria are essentially your power cells. It's like the battery of your body. Now, what do you want a battery to do? You want it to provide power, you want it to maintain charge, and you want it to work efficiently. And if you think of that as what your mitochondria are doing, then that will give you an overview or an understanding of if you can have a good power cell, which gives you loads of power, which doesn't kind of die out quicker than it should be, and is able to utilize the oxygen, the fuel, and create a greater output. You could imagine the benefits associated with that.
Yeah.
Like when your phone's out of charge and it's always draining battery.
Correct.
If you have a phone that lasts forever.
No app is working well when the battery is low.
Absolutely. You go into onto conservation mode. What you want to do is be functioning at 100% for as much of the time as possible. And eventually, if that's what we can do to your body by improving mitochondria.
But you told me also more about changes that happen in the cell when the cell ages. For example, at the DNA level, and also,
Yeah. So I think what you're getting at here, Mark, is probably the epigenetics of aging.
Yes.
Now, there's this concept of aging associated with telomere, I think is another hot word now in the aging stratosphere. And ultimately, telomeres are these small caps on your DNA. Any single time your body wants to make a change, your DNA will unwrap, a message is copied over, and then it rewraps. Now, that's great because we have this mechanism inbuilt to us, but every single time that happens, comes at a cost. That little protective cap, it's like the rubber on the back of a pencil. You make a mistake, you rub it out. You make a mistake, you rub it out. What happens to the rubber at the end? It slowly wilts away when you're left with nothing, no more rubber left, and you're left with a pencil. And then you try rubbing it out and you've done more damage. Now, the same thing is happening with your DNA. That rubber is being used up, or that telomere is being used up, to the point when your telomere is no more. And what happens then? Your DNA can neither replicate, nor can it ultimately undergo its normal program of cell program death, apoptosis. So what does it do? It hovers around waiting. Now, when it can't do much, it just will hover around and deposit itself. When it deposits itself, it becomes what we call a useless cell, a senescent, an age-related cell, and they can deposit, can accumulate, and they can be a significant risk factor for ultimately dementia and cognitive-related change.
But also they are a risk factor because they cause some inflammation.
Absolutely. Inflammation and precancerous changes. So they don't only cause you to age, they cause you to increase your risk of significant conditions in the longer term, inflammatory, malignant.
Umair, now you have told us what's actually inevitably happening to all of us, which is somehow scary, all these senescent cells and the telomere shortening and the things that are going to happen to us. However, your therapy can stop and even reverse this.
Now, when you say it stops or reverses it, I think it's just one part of the jigsaw. I'm not going to claim that coming into a hyperbaric oxygen therapy environment and doing our program will fix every qualm that you have. And medicine, as you know, is never just one piece in isolation.
One fits all,
It's 100%.
Unfortunately.
It's not one fits all, and it's not one aspect in isolation. And the argument I always use with our clients is, you're not going to go to the gym and spend 2 hours there and then finish up and go and have some fast food burger and chips and expect to see a six-pack. You know what I mean? So it's one part of the jigsaw. What we have is ultimately a clinically proven, clinically researched piece of the jigsaw. And from my point of view, probably something that's core to this process, but it also involves looking after other aspects, the modifiable risk factors of aging. What you're eating, how much you're exercising, how much you're engaging your brain and keeping it active. So as part of our process, we also have within our amazing team, physiology, physical therapists, a dietitian, neurocognitive support. All of this essentially is a collaborative effort to make sure that you have the perfect conditions to be proactive rather than reactive.
How about diet? Does it play a big role?
Absolutely. Absolutely. One would argue one of the bigger roles. We always hear this thing, you are what you eat. I'm sure you've heard it. It's extremely important. Food is a massive aspect of the aging process, and there are foods which are always considered better for you than others. There are diets which are considered better for you than others, and I'm sure that now in the modern world we live in, there's a whole catalogue of diets. Keto.
Well, the reason why I brought this up with the diet is also because there is now also a very modern term, the interval fasting or intermittent fasting. Which is somehow a similar concept to intermittent hypooxygen or hyperbaric oxygen. Is it comparable?
Intermittent fasting itself is an approach that I like, and it's actually an approach that we adopt where possible within our clinic. And the reason for this is it's very pro-autophagy. It's very pro-almost detoxification, removal of waste products. It encourages this process. It's slightly different to what we're doing. What we're doing is probably more akin to a training concept where you're doing a high intensity interval training.
I was just thinking, if I am already committed to do intermittent fasting, wouldn't it be good if I would also then say, okay, I step it up. I do also the therapy in Aviv Clinic to make the entire concept like round, to round it up, to wrap it up, to have it all bundled, everything that I can do for my fitness and health and aging. Would that be a good idea?
I mean, absolutely. Like I mentioned, what we do over here is promote hyperbaric oxygen therapy as the core, but we also make sure you're doing all of the other basic principles which we know. You're controlling or addressing your modifiable risk factors, so you're creating the environment. What we're doing is probably taking it to another level, but those principles are just as important as they've always been.
If I want to have this therapy, if I want to live longer and I want to live healthy longer, what would be the steps to sign up here in this clinic? Do I have to come as an accident, or how is it?
I mean, absolutely not. If you are genuinely interested in what we are doing, what I would encourage is to come along, contact us, get in touch with us. You can find us on the internet. You can call up our number, which is 800 Aviv. Speak to somebody and we'll arrange to get you in first and foremost. And
800 Aviv,
yeah,
which means which numbers? 800 Aviv?
I don't know off the top of my head. 800. We'll get you that in detail. 2727, I think. But ultimately, what it is I think we have a very important role within the aging process.
Yeah.
And for me to say that every single person that's going to come through this door is going to be a candidate for what we offer is very wrong. I think it's not the right approach. I think we said before, medicine is not one for all. It's a very bespoke and tailored approach, and I think that works best. So what I would encourage people is to come
first and check if they are eligible.
Yeah. Well, first of all, read up about what we are offering.
Yeah.
Get an understanding of what we're offering, and come in and meet us. Have a discussion, show you around the facility, and then you can have a very bespoke or tailored consultation with one of the physicians to discuss and address your needs and decide what might be the best approach for you.
But I know for sure you have some celebrities coming here. They usually know what's the best. I mean, I always want, for me, also what the celebrities want to have. Yeah, why not for me?
I wish I could comment a little bit more, but as you know, as physicians, I don't think we can.
No, but I mean, this is the stuff that makes the people look young, or be young, or act young. Although you think, hey, they were already on TV when I was a kid. Still, they look the same. Yeah.
Look, I'll go back to one point that you mentioned to me earlier, and you touched on it on sports performance. There's a reason why we are seeing certain athletes performing to the best of their ability for longer. And I'll give you examples of two renowned athletes. I always use these ones, so people probably say it's a bit cliched, but Novak Djokovic, Cristiano Ronaldo. The two athletes who are in their late 30s, yet you have somebody who set the record for the most number of Grand Slams and is continuing to win Grand Slams in tennis.
Amazing. Yeah.
And then you have somebody who set the record for the number of goals at an international level and is continuing to score at an international level. And it's by no coincidence that these guys at the age of their late 30s are outperforming athletes 10 years their junior. And part of that process, and both are very keen advocates of hyperbaric oxygen therapy, number one. And number two, I would probably say, have you noticed as years are progressing, more and more world records are being broken?
Yeah, that's a little bit strange, isn't it? I think this is the proof that everywhere there's doping. Yeah.
Doping is one argument, but then the other argument is also the fact that we understand physiology, we understand the human body better than we've previously understood it, and we're also able to tap into that minutiae of detail to enhance and optimize physical performance.
Yeah. Probably, but you know what? I happened to read about Joseph Pilates. Did you hear about Joseph Pilates?
No.
He's the guy who invented Pilates, and that was in the 1920s or so. And he was just coming from boxing or something like this, boxing and karate, and he just wanted to do something that is really good for physiotherapy It's good for for sport people, you know? And it's still the latest in physiotherapy, as far as I know. Yeah,
the concept's there. Yeah.
Concept. So it's an old concept, and actually helping people to be on the top in sport, like dancing and this kind of stuff.
Interesting.
Anyway, yeah, and we are sitting here now in one of these chambers. Yeah, obviously there's lots of technology now inside, and it would be risky to put this technology when you're sitting here for a therapy. And so this is how it looks here. There are pressurized windows and doors. I think the windows are not windows; it's just light.
Yeah, gives the appearance of an
aeroplane. It looks like an aeroplane, like you're sitting in a private jet. And and this is where you spend your time when you do the hyperbaric oxygen chamber.
Absolutely.
Therapy. So how many hours will you spend here?
So typically within the chamber, you're going to be doing 2 hours.
2 hours.
5 days a week.
Isn't that boring? That's why you have here TV screens, huh?
I mean, to a degree, look.
Cool.
What it harbors here, that's pretty cool, is that you actually have a bit of a community. You make friends, people turn around and connect with one another. In between your chambers, remember, you have air breaks, and this gives you a little bit of a break. But generally speaking, these devices or these tablets are targeted to, they're actually uploaded with a program that's specific to every single individual, targeted at their cognitive weaknesses. So we use a few specific brain training programs, which have actually been clinically proven to work first and foremost, but actually we have a neurocognitive and neuropsychiatry team who actually review your cognitive performance, work out your areas of weakness, and actually target on improving them whilst in the hyperbaric environment. So actually we can target areas of the brain which are responsible for your areas of weakness and improve those specific areas.
So you don't waste your time while you're sitting?
Absolutely no.
So you have a very good quality time sitting in here. And you get a benefit of the hyperbaric oxygen that we discussed first. And then you go home and expose your body to the threat.
To a degree. Depends what the threat at home is.
And you harvest the benefits of being exposed to the threat without being exposed to the threat.
Without getting any harm.
Because you're not exposed actually. It's just that your body thinks you're exposed. It's tricked into this.
Yeah.
It's very nice here actually. I would like to have more, see more about your clinic where you're working. How long are you working here?
So I've been here now for just over 3 years. 3 years in January.
And you love it, yeah? Did you get? You're much older than you said, and you're using the chamber meter.
I'm younger than I look, you know. I mean, I've been here for 3 years, and they've been 3 great years, genuinely. We have a great team, and everyone really loves what they do here, and that makes a world of difference. And ultimately, we get quality time with our patients and our clients, and that makes a world of difference. We know them better than they know themselves. That's
really, yeah.
That's part of what we say.
Because you analyze that.
Absolutely. And
that's what we do as doctors. We know more about the people.
But in traditional medicine, how long do you get with a patient? 10 minutes, 15 minutes, half an hour?
Yeah, we do always half hour.
We get 3 months.
Yeah, very good.
Makes a world of difference.
So this whole thing is done for 3 months, and after 3 months I'm done, or do I have to repeat it again?
So after 3 months, we re-evaluate you. So one thing that we are quite strict about is having objective, tangible measures, so we can measure where you are. So you measure where you were, you complete the treatment, you measure where you're at the end of the treatment, and actually we check in with our clients on a 6-monthly basis and re-evaluate them on a 6-monthly basis, so we can, in theory, track how they're performing at baseline, post-treatment, and on a 6-monthly basis. Now, every individual is different, and we already spoke about the fact that whether or not you need to... Are you okay?
Yeah, I'm just checking I heard some noise, some sound, as if one of the cameras is off, but mine is still on. Good.
Right. So like we said, we need to track objectively where you're at and where you're going to be at and where you're going to end to.
Actually, my camera is not on. Unbelievable. Is your camera on?
Yeah. I think it just went off probably.
This one is on. Oh no, it's on. Sorry. We need to cut that out. But anyway, it's easy to. Yeah. So I wanted to ask you something else. This whole topic is so interesting. Are you doing research here in the chamber?
I mean, we've done case reports. We have a wealth of data around what we've done in the past, and we're continually adding to that.
Yeah.
Look, I said medicine is always about learning, adapting. And I think when we met, I spoke to you and I mentioned something. When you qualified from medicine to where you were 10 years later and every 10 years, and remember, I qualified in 2009, so we're 15 years down the line.
Yeah.
Medicine in that time has changed so much.
Yeah.
And new concepts, for example, heart failure management, what we traditionally did before and what we do now is completely different. Yeah. So we're constantly evolving. So yes, we have a duty to a degree to measure data, absorb that data, and actually analyze. And it's a constant process. So yes,
we in our clinic, we are doing. I mean, we have the duty to do quality assessments, and also have to fulfill certain points that also the DHA requests us to do with regards to improvement and Kaizen principle and all this kind of stuff. But on top of that, we try to get somehow data about the effect of our therapy. So some real quality data about the actual medical treatment, if that was effective or not. You do that as well?
Absolutely.
So you do some assessment before and which you can compare after?
Absolutely. The objective measures are probably the most important pre and post treatment that we have to show, because a client can say, I feel great, I feel the same, I feel worse. What you can't argue, you can argue with the subjective. Yeah. You wake up and have a horrible day the night before, don't sleep well, you subjectively feel bad. Yes. But you try to compare that with an objective measure that's not easily manipulated. Yeah. You can't really argue with that. So objective data is key to what we're doing. And whether that be imaging, whether that be neurocognitive analysis and performances, or whether that be physical.
Yeah, I believe very much in these questionnaires, to be honest, because they are very subjective. But at the end of the day, we want the person to feel better and not the CT scan image to look better.
Absolutely. I think they need to go hand in hand.
Yeah. All right. Do you have anything that you would like to say to the audience? Is there anything that I forgot to ask you about this topic?
No, I think you've been first and foremost, thank you for actually coming over and coming and visit us.
Thank you for inviting me to this amazing clinic here.
No, it's been a pleasure to have you and have this conversation. I don't know, we spoke about this for a while, and I'm glad it actually finally came to fruition. I mean, I think we've touched pretty much on the scope of what we do. Yeah. And I would probably implore anyone, if there's more information that you want, if you want to have a discussion, just reach out to us. We're all very approachable, and we're all more than happy to answer any questions.
So actually, I have just one thing came on my mind. We touched it a little bit, but again, I want to talk about that. We have in our clinic, in Mueller Medical Clinic in Healthcare City, we do a lot of surgeries, and we would like to send our patients, especially our plastic surgery patients, facial plastic surgery patients, maybe upfront to you to have some kind of pre-operative treatment and then even post-operative treatment to get a faster and better healing. Is that possible? Can we do this?
Absolutely. I think we actually already are doing that within our clinic. We have we've got a good connection with some of the local surgeons, and what they've actually fed back to us, what they are actually recommending for their clients is ultimately prehab, i.e. pre-surgery, to ultimately optimize the quality of the tissue that they're dealing with. Yeah. And after the treatment, a rehab almost. Yeah. So anywhere from 5 sessions before to 5 sessions after. And what we found is that the results, the healing, and the improvements post-surgery are amazing.
Yeah, that's amazing. This is exactly what we are looking for. And how about patients with tinnitus and with sudden hearing loss? What's the time frame when we have to send? And
I mean, I should probably ask you this, Mark, because your specialty. Sooner the better is always our point of view. Yeah. As you know, sudden onset of sensory neural hearing loss in particular, one of the indications down the line is if you don't respond to your initial first-line therapy, ideally you want it as soon as possible. The longer you wait, you probably are getting to the realm where there's not as much evidence for it to work. So in an ideal world, the most important thing is probably collaboration with yourselves, the ENT surgeons or the ENT specialists. Tried your initial treatment hand in hand with something like an intratympanic steroid, the hyperbaric oxygen therapy with baseline audiometry test and post-treatment. And we've had a few that have actually already gone through the process and had good results.
Yes, we would actually like to do that parallel. That would be good because otherwise we would lose the time. And we have a handful of people who came too late and where it's really frustrating that none of the therapies really helps. And to have one more option is really amazing, would be good with regards to tinnitus and hearing loss, but also loss of sense of smell, which is quite common now after the pandemic that we all went through and the sequelae of this time. I see quite a high number of loss of sense of smell. Would that be also a field where your expertise or your treatment would be beneficial?
I mean, I probably would say the anosmia on its own, the loss of smell, loss of taste, as an individual entity, probably not so much. But as part of a symptom of a longer COVID phenomenon, we've actually got a lot of research. We've done a few case reports and we've actually got a treatment modality for long COVID, which is a 40-session protocol over here. And we actually have treated quite a few patients with these symptoms with great results. Long COVID is very interesting. Yeah, because long COVID actually shares its physiology to a degree with it's a neural inflammatory process. The virus actually enters directly and goes across the cribriform plate and causes neuroinflammation. And this classic symptom, which I'm sure you've heard from people, of brain fog, of a slowing down of their cognitive function, coupled with the myriad of symptoms associated with long COVID, whether it's loss of sense of smell, mood-related changes, GI symptoms. There's not a system that's not affected by it. We actually are providing a very viable and realistic solution that people are willing to utilize to address this problem. I know if I was in that situation where I don't have many options.
I know there are thousands of people out there who need your therapy, actually.
Absolutely.
We're struggling. We think that it's sinusitis that gives the brain fog, or that gives that is the trigger for the anosmia, and then we treat the sinusitis and it's gone. CT scan is clean, and then we wonder what can we do. The patient doesn't know what's they are really desperate. They don't know what to do after that, and I don't know. I should send them to you.
100%. I mean, it's a viable option to have a word with us to see if we can do something for them. One thing where we do pride ourselves on is we don't do charlatanism. We are clinically driven. Our decisions are made on a clinical basis, and we pride ourselves on the fact that we can back that up with good evidence-based medicine.
Good, great.
I think that's important.
Great. So, was so nice speaking with you, Umair.
Sure.
I'm glad that we met. I'm glad that we got in contact through this one patient. I hope she will come back to my clinic soon. And that was very, very, very interesting. And I hope that everybody who listened to us here found it as interesting as I found it. And and that I wish you good luck with this clinic.
Thank you so much. Really appreciate it.
Clinic, Aviv Clinic, 800 Aviv.
We'll get the number. Thank you so much.